This is an instructional video about ElectraRx, an online stimulation session management portal provided by Soterix Medical for remote neuromodulation. The portal is accessible at soterixmedical.com/ElectraRx/login. After purchasing the equipment, the Soterix Medical support team can help you set up your account. Once the account is set up, you can log in and see the account overview along with some additional information that has been entered by Soterix Medical's support team. The information that is visible to the patient is shown on the left side, and you have the flexibility to edit as needed. The next option on the overview page is the practitioners window. You can add new practitioners and set different types of access to each. Start by clicking Add Practitioner and fill out the basic information: name, email address, contact phone number, and then select the sort of access you want to the new practitioner. The access can be view-only access, in which the practitioner can view the activity in the portal, including the patient's activity. The second option is Edit and View, in which the practitioner can edit the information and assign and unassign devices to patients. Under the treatment option, you can see the built-in treatments that are available. The first is Depression TDCS LTE, and the second is PainX TDCS System. These options come built in with any device provided by Soterix Medical for ElectraRx. Clicking on any of the treatments will provide more details about them. For example, Depression TDCS LTE is a 4-week-long treatment with stimulation sessions on Monday through Friday. Each stimulation is 33 minutes long, which includes 30 minutes of stimulation and 3 minutes of setup time. The next line relates to smart impedance monitoring, a feature that comes with every device from Soterix Medical for ElectraRx. This feature allows the patient to check the electrode contact quality before, during, and after a session. Under the Scheduled Assessment section, you can view all the questionnaires that have been assigned to the patient for Depression TDCS LTE treatment. Another available built-in treatment is the PainX TDCS system. Custom treatments can also be added, so let's look at an example. In this example, we named the new treatment Test Treatment and selected the number of days in which the portal would release a stimulation code for the patients that can be entered into their device. You have the flexibility to select as many days as you'd like, and in this case, we selected Sunday through Thursday. Choose the number of weeks for the stimulation. Once the stimulation period is over, the ElectraRx portal will stop dispatching the stimulation codes to the patients. The following option is Session Duration. If you purchase our pre-programmed ElectraRx devices, then the Soterix Medical support team will program the devices up front, according to your request. You can then add the same device settings on this page. If you are programming the device yourself, then enter the program settings from the device. Note that these values for stimulation duration and current intensity are for record-keeping purposes only. The device will deliver stimulation based on what is programmed on it, either by the Soterix Medical team or by you. The next option is the questionnaire. You can either select one of these questionnaires or simply skip this step by clicking None. Once all the treatment details have been entered, you can click on the Add Treatment option button to create the new treatment. You can also review the details of this new treatment at any time by expanding the treatment using the Click for Details button. As shown in this example, there is a 4-week-long treatment for stimulations from Sunday to Thursday with a 20-minute stimulation per session and 3 minutes of setup. The next tab is Devices, which shows all the devices you have purchased from Soterix Medical. Every new device you purchase will be assigned to your account, and it will be shown here. The devices are assigned based on their serial numbers, so you will be able to match them to the physical device. Devices that are pre-programmed by Soterix Medical contain a fixed set of codes. For devices that are not pre-programmed by Soterix Medical, you can enter the codes that are programmed into the device using the administration menu by selecting Add Device Codes and entering each code manually. Once the devices are programmed, you can add the stimulation codes from the device to the ElectraRx portal. Under the Patients tab, you can see the existing patients and add new ones as needed. After clicking Add New Patient, fill out the first and last name and add the email address. The rest of the information is optional. The ElectraRx portal is HIPAA compliant, but if you are concerned about sharing patients' information, you can add a pseudonym such as Patient 001, Patient 002, and so on, as long as the email address is valid. At the top of the screen, there is an alert icon, which provides alerts based on your patient's responses. For example, if they state they are not feeling well upon logging into their account. Another option here is Support, where you can contact Soterix Medical for any questions you may have. That sums up all the different tabs. Now I will show you how to assign a device to a patient and then show the patient's side of the ElectraRx portal. To assign a device to a patient, go to the Devices menu. Here, you can see all the devices that are currently assigned to patients and the ones available for assignment. Let's assign this device to the patient Ariel Tristan and select the relevant treatment option. All the available treatment options are shown here, such as Depression LTE, Pain X, or any other treatment you have created. After selecting the treatment, choose the starting day, which could be a future date as well, then hit Activate Device. You will receive a confirmation that the device has been assigned to the patient, along with the serial number of the device. You can also go back and check the details about the device, including the number of remaining treatment codes. In this case, we can see the devices assigned to Ariel Tristan, with the treatment named Test Treatment. The treatment is ongoing, and the assessment is also ongoing. Now we will log into the patient account and see all the options that are available there. Once you add a new patient from the doctor's account, you will be able to email the patient to set up their password. Let's look at the demo account of the patient Ariel Tristan. After you assign a device to the patient will receive a confirmation message about the assigned treatment, including the doctor's and clinic's name. The patient can click Continue, and they will be asked how they are feeling today. This is a basic question that every patient in the ElectraRx portal receives upon logging in. If the patient selects OK or Good, they will be taken to the next page. But if they select Bad, then the portal will ask some follow-up questions. They can select multiple answers, add comments, and after clicking Continue, their response will be submitted to the doctor's account. In this case, we did not select a questionnaire for Ariel, so the portal directly leads them to the stimulation code. Confirmation about scheduled treatment for today and a stimulation code is shown. The patient can use this stimulation code to conduct one session for the day. In this case, the treatment is a 20-minute active session with a 2 milliampere intensity. At the end of the session, the device will generate a completion code that will be entered into the portal by the patient. You will be able to get all the information related to the session, including the total stimulation time, whether a session was aborted, and whether there were any critical events. This information will be relayed back to you on a real-time basis once the patient enters the completion code. If a patient tries to move away from the stimulation page without entering the completion codes, the page will create a warning message about leaving the page with unsaved data, and they will have the option to cancel and input the completion code. Once they hit Continue, the stimulation will be logged in for the day. The patient can also see their treatment diary. For April 9th, there was a treatment scheduled. In this case, the assessment was done and the stimulation code was dispatched. There is no treatment scheduled for Friday and Saturday, so this section will appear gray. The patient can also see the end date of their treatment, which in this case will be May 6th. Under the account information, the patient can see all the information that was entered by the doctor, the name of their doctor and clinic, or any practitioner that was assigned to them. They can also click on Treatment History to see if all the treatments were completed, or any treatments that are currently assigned to them. The support section appears on the patient's portal as well, and they are able to contact a doctor by phone or email. They can also watch the ElectraRx tutorial, ask questions about their device, and learn more about Depression LTE and Pain X. We will now go back to the doctor's account to see what shows up after patients' responses. On the overview page, you can see an alert, and in this case on April 9th, Ariel Tristan reported problems of anxiety, sadness, and a lack of focus, so you can take the appropriate actions. By clicking Device Information under the Device menu, you can see the device history and any current or past treatments that were assigned using this specific device. Currently, the device is assigned from April 9th to May 6th, with a total of 20 sessions, one of which is completed, and there are no missed sessions. Therefore, there are 19 remaining sessions. The treatment status is ongoing, and if a patient misses a session, you will see it here. You could also click on Click to Expand to see additional details about the ongoing treatment. After the patient enters the summary code, you'll be able to see any critical events during the session, along with the critical events details, stimulation time, and if the session was paused or aborted. In addition, under the Patients tab, you can see information about the questionnaires that were assigned to them by clicking on Patient Information, or clicking Treatments and Assessments. Note that there is no information about a questionnaire since we didn't assign one to this treatment, but you can see this information under previous treatments using this device. By clicking on the questionnaire, you can see the patient's responses. Another feature of ElectraRx is the ability of the doctors to log into the patient's account. If the patient is unable to log into ElectraRx for any reason, simply log into the doctor's account and go to the Patients tab. Select a patient and click Log in as Patient. You'll be able to see your name, in this case, Dr. Ashley, to confirm that you are logged in to your patient's account. You will see where the patient left off, any questionnaires they may have, and the treatment code that is provided to them. You can give them the code over the phone and receive and enter the summary code once they finish the session. By clicking Continue, the treatment will be saved for that day. Once done, click anywhere on the device's window, and you will return to the doctor's account. If you want to unassign a device from a patient, you can click Stop Treatment at any time, and the portal will stop releasing stimulation codes to the patient. This concludes the functionality of the Soterix Medical ElectraRx. For more information, please visit us at soterixmedical.com.